Why is it important for a patient who has had periodontal treatment in your office to return on a regular basis for follow-up care?
It's an interesting thing. We're used to having a tonsillectomy and that fixes the problem. Or I could, you have a bone set and that fixes the problem. That's not the nature of gum disease and the treatments for gum disease. Gum disease is a chronic disease that in many patients, many patients, we never cure them. We control the disease, like diabetes. We don't yet have a fix for diabetes, but we can keep it from doing damage. And so with gum disease, we minimize the impact of the causative agent, bacterial plaque. And we do so by making your mouth cleanable both by the professional and, as importantly or more so, by the patient. And that's really the key. Ultimately, what I've taught my students is the real treatment for gum disease is patient-performed plaque removal. And in your average patient, I believe, you only need to do that one time a day. It's realistic. Doing it 3 times a day, I believe for many people is not realistic. And I have a whole practice filled with long-term healthy periodontal patients who only do it 1 time a day. Without that component of the care, it is likely that the gum disease is going to return. And what we've learned both through experience, and I'm not the only person who's learned this through experience, this has been known a long time, and there have been studies about this, is that a perfectly trained and performing plaque remover, given time, will slide, both technically and behaviorally. And we know that if people come back to the office on a regular basis and we get to help them, say, you're missing here, let me show you because you've forgotten how to get there. Or, come on, you're bleeding a lot. You got to pick up your game. And there are graphs that show that people oscillate in their performance. And that can be directly correlated with their visits to the office. When we work with patients in their personal plaque removal, it is a serious, focused service. It's not a little ancillary one on the side where the hygienist or the dentist says, now remember, floss your teeth. No, we're focused on this, and our patients know it. And it's not about us being focused, it's about them being focused and them being as important or more important of a therapist, a self-therapist, than the professional.